Hi and welcome to Askimo TV. I'm talking today to Dr. Elliot Sorene. Dr. Sorene is a consultant orthopedic surgeon and specialist hand and wrist surgeon at the London Clinic. Hi Dr. Sorene, how are you?
Yes, I'm very well, thank you.
Dr. Sorene, we've spoken about carpal tunnel syndrome in previous interviews, and today we're going to talk about the surgery. So just remind us again, what is carpal tunnel syndrome?
So carpal tunnel syndrome is a condition which comes about from a variety of reasons, which causes compression of the median nerve, the main nerve that gives sensation to this side of the hand, the thumb, index, middle finger, and it also gives power to the muscles of the thumb, and that's carpal tunnel syndrome, which can cause pins and needles and weakness and pain within the hand. And the surgery itself
when
involves
surgery does become
a small cut.
Yeah.
Well, surgery is
Carry on.
needed if the patient has significant nerve compression on the nerve conduction studies, or if it's affecting the patient in such a way that it's affecting the activities of daily living and they're not getting by with any other method of treatment, such as splintage or physiotherapy. And if the nerve is actually being damaged, it needs to be released.
So what does actually happen in the surgery? What do you do to fix the problem?
Okay, so the surgery can be undertaken under local anaesthetic or general anaesthetic, or under local anaesthetic with a bit of sedation. And the surgery itself involves a small cut, and you can actually use quite a small cut, just here at the base of the palm of the hand. One cuts through the skin, and there is a belt of tissue, a ligament which presses on the nerve, and this is released. The nerve is thoroughly released, and then there's a few stitches to close the wound, and the patient has a large bandage on the hand which leaves the fingers free, and that's the operation.
So what should or shouldn't patients do post-op to recover as quickly as possible from surgery?
Whilst the operation is a very small operation and the incision, the cut itself is very small, the hand can swell up. So it's important for the patient to move the fingers as much as possible, and hopefully the patient will be put in a bandage which don't cover the fingers. The patient needs to wear a sling, ideally keeping the hand above the level of the heart, and this also helps the swelling come down. And it's important not to walk around with the hand down. Keep the wound dry, keep the bandage clean, and ideally for 2 weeks to keep the wound completely dry for the stitches to heal. And the stitches will either be dissolvable stitches or removable stitches, and that will certainly improve the result, and that's the immediate post-operative advice. After that, once the stitches are out, there are techniques to massage the scar to get the scar to heal in a quicker way, and to stop scar sensitivity and problems in that area.
What are the possible risks or complications to the surgery?
Sometimes the main complication is if the patient's symptoms aren't from carpal tunnel syndrome. If the patient hasn't had nerve conduction studies, you can have identical symptoms with neck problems and other problems. So the main complication will be the operation not working. However, if the patient's thoroughly examined before the surgery by an expert in the field, if he's undergone nerve conduction studies, then this should be avoided. The other complication, which is quite unusual, would be wound infection, and that's more common in patients with diabetes and with immunological problems. The wound getting infected, which may need antibiotics. Once again, that's very unusual. And the other complications are pain and stiffness in the hand and swelling, which can be avoided once again by mobilizing the fingers as soon as possible.
Once you've had the surgery, is it possible for carpal tunnel syndrome to come back again?
Well, certainly it can come back, but after a good carpal tunnel decompression, you're talking really 15, 20, 30 years before the symptoms should recur. But certainly this can happen. The ligament which presses on the nerve does reform and does heal, and certainly this can come back.
Is there anything that people can do to prevent it from coming back?
Well, patients, if it's related to their diabetes, if their diabetes is kept in order, patients with rheumatoid arthritis, if their rheumatologist manages their underlying problem, patients that operate heavy machinery, which could be causing this, if they stop operating that machinery or take breaks as recommended between operating on heavy vibrating machinery. But pretty much it's, once again, such a common condition, it's difficult to avoid.
Thank you, Dr. Sorene. Thank you so much for speaking to me today.
You're welcome.